Okay, hello everyone. Welcome to Keeping the Kids in Mind, a University of Sydney seminar series based on providing expert leadership, discussion and advice to families during the pandemic and to enlighten us on different issues that families are concerned with at the moment. Now, last week we had Micah Goldwater present and discuss with us about extreme belief formation and how health beliefs can often become part of an individual's identity. And I encourage you to watch that series on YouTube. He had some great advice on how to manage extreme beliefs in the community and particularly for your family members. We've had some wonderful presenters and from the hospital, Phil Britton and Nicholas Wood and Catherine Knight. And tonight, from the Sydney Children's Hospital Foundation, I'm absolutely thrilled to welcome the Chief Executive Officer of the Children's Hospital Foundation, Nicola Stokes. Welcome, Nicola.
Hi, Adam. How are you? Hi, good evening, everyone.
Now, I should have introduced you properly, but I've got the introduction in front of me. Nicola, you are the Chief Executive Officer of the Foundation, and you've held national and international leadership positions in the corporate and for purpose sectors as CEO and Senior Executive Officer and Director. Throughout your career, you've supported individuals to achieve their potential and observe the importance of mental, physical and emotional well-being. You've led work in the health arena, and with this in mind, you became a member of the New South Wales Premier's Council for Active Living and the expert advisory panel of the New South Wales Office of Preventative Health. You were awarded the International Quality and Productivity Thought Leader of the Year for Asia. And we know through speaking with you at any point how inspired you are by the children and families that the Foundation support. They give you the motivation. It's obvious to everyone that you are incredibly motivated by the kids and the families to fundraise, to find solutions to increase the amount of funds raised for sick kids while strengthening communities. Now, the Foundation's very lucky to have you, and I'm very lucky to have you today as well. So
I'm very lucky to have the role. It's my honor and my pleasure. And Adam, it's always great talking with you and learning from you.
Now, actually, I learned something today. I didn't realize, I haven't heard of the International Quality and Product Thought Leader of the Year for Asia, but that sounds like an incredibly prestigious award. Can you tell me what led to getting that award?
Yeah, thank you. I was very, very proud to receive it. In a previous life, I was the Global Head of Shared Services for ANZ Bank. And one of the things we were trying to look at, and so I ran all of the infrastructure, everything internally that actually runs the bank. And we were looking at how do we give our customers the better and the best experience that they can have. And so I designed a shared service model that ran and built in Bangalore in India that would differentiate between personal customers and business customers. Our personal customers wanted a personal experience. So I'm sitting in Sydney or Melbourne or Brisbane, I phone ANZ Bank. You were talking to someone in Sydney or Melbourne or Brisbane. We built it that way. And then for business who are trying to reduce the cost of actually running their organizations, we ran the call centers out of India, out of Bangalore for that. And we were able to then, rather than just look at a process end to end for the value of the process, we look at the human being in the process and then how we actually made the process work around the person to deliver them the experience that they wanted. And I built that, and then I helped Macquarie Bank build theirs in India and brought Rio Tinto to see how we did that. And that's what I received the award for, to take a different view and putting the human in the actual process to get the best outcomes.
I mean, it doesn't sound that different to what you're doing now in some ways, Nicola. It must have been are there many differences between that you see working in the corporate space versus the sort of, now that you're in the public health space, I guess?
Look, I think the shift for me, the reason is very similar. When I saw in the corporate world people living up to their potential, or if they didn't, it was always their mental, physical, or emotional health that holds humans back, individuals, families, adults, children. It's the same. I could see it just in the wonderful people that I worked with. And so if I then thought I wanted to make a bigger impact in the world, my little me, what can I do to help community and everyone around me? Why don't I take that motivation and actually try and bring my skills into health and get sort of better outcomes for sick kids and their families? So that was my shift. So for me, it seems the same. It's that you think of the human being first, and you build your business, your foundation, your organization, whatever you're doing around the person, the human, to give them the best outcome.
Well, this discussion is going to be about curing homesickness. And this was really something that you brought to my attention from the foundation, actually. It's something that you've been working at for a long time. Maybe this is the next thing you'll get the big Asia Pacific Award for. But can I ask, what is the homesickness initiative to you? I'm actually interested to know why it's important to you.
Yeah.
And what sort of impact would you like to have around it, just like you've had that impact with those banks and customer services?
Look, I think everyone would resonate with everyone. A few years ago, there are so many charities asking people for money. And unless you have a direct connection with one particular illness or injury or piece of research, you get phone calls, you get stopped on the street, you get loads of mail, and it's exhausting for community. It's confusing. And like, how do you give? How much do you give? Do you just give to one? Do you give to many? And so we were looking for a way, because when you support hospitals, it's every child, it's every disease, every illness, and it's Sandvik and Westmead and Bear Cottage and the kids' research for the state and NETS, which is so important. It's how we get the children to the hospitals and back from regional remote. But when we talk about it, we have to talk about all the different illnesses and injuries and families and kids and clinicians, etc. So we wondered, is there one thing that all children suffer from when they're in hospital, no matter why they're there? And with lots of support from external organizations, all pro bono work, they went and interviewed families, clinicians, nurses, staff in the hospital, people who brought the meals, the clears, what was their experience? And they all believe that children suffer from homesickness when they're in hospital. And so we all know what that feels like, yeah, as an adult even, and maybe when we were at school or away on camp or something. But a hospital is a much, much more difficult situation. So homesick in hospital, you sort of think that might be even worse. So we had to find out if that's a real thing. Does that impact health? Which is, of course, Adam, where you came in, and the wonderful research that you're doing for us to talk about the impact of homesickness on children when they are in hospital. And so we wanted to be able to give the community something to do that would impact all of the children, so all of the diseases. And we thought, so how do we raise the money? What will we do that's different to make it easier again for everyone to help? And so when we not only did the research on what the kids were, that they were homesick, it's what did they miss? What made them homesick in hospital? And children talked about mom's cooking, they talked about their dog, they talked about sport, they talked about school, and obviously friends and family. And so with the first one, the theme was, hospitals try really hard with food, and we know that, but the mum's cooking, this sense of home in relation to mum. And so we've had a long term relationship with Coles for many, many, many years. And so this concept of a pasta sauce, a mum's sauce, started to evolve. And so I went to Coles and I just asked them, would they make it? And they said yes. Right. So anyone who's in that business knows that it takes a long time to produce a product and package it and put it out. But they found it so compelling. And they said, is this national? And as with all good ideas, I said yes. And I'm great colleagues in all the other states and territories in the foundations that support those hospitals. And I phoned them, went to see them when we could see people. I said, will you be part of this? And they said, absolutely. And so what happens is that Coles created the pasta sauce first, just one first. And of a $3 jar, they were giving us 50 cents. That's probably the highest portion of any product sales a charity or a foundation ever gets. And then what they do is they tell us where the product was sold by postcode. And so then all the funds come into us, which makes it easier for Coles. They only have one relationship to manage, but we just send the money back out to the state or territory where the postcode, where the actual product was being bought, because it is, our hospitals are ours, they're in our states, they're where our children will go if terribly that we need them. And so it made this lovely connection to, you're doing something good for your family, you're buying a jar of sauce, 4-star health rating, at the same time you're doing something good for the children who are in your local pediatric hospital in your state.
What a great story. And in some ways it provides a mechanism to do things at a national level, it sounds like we can, there's a funding possible mechanism to at least start the process of trying to change healthcare in hospitals nationally. Is that right?
It works because we're foundations. Hospitals are state-based health systems. They're not federal, but the foundations can have different relationships than the hospitals can. And so we can be the facilitators of this for the best for families. And some children also go to other hospitals in other states for treatment, depending on how we're going to look after them and what they need. And so this is a really nice, consistent piece. And then because we're all different, the funds have to be used to demonstrate reducing the length of stay in hospital. And that's how we come back and tell the community what was done with the money, because that's the whole piece. If we can reduce the length of stay, children get home sooner, and we know that's where they will thrive. But there's lots of different ways of doing that. And I think that's important. And one of the strengths of the program is we're not trying to put in or mandate one way to do it nationally.
Yeah.
It's, here's the funding, what's going to work in your state or territory. For example, children in the Northern Territory who actually need high-level pediatric hospital care go to South Australia because they don't have those facilities in the NT. So the product sold in the NT, the money is given to South Australia women and kids, but it has to only go to the children from the Northern Territory who use the facilities. So we've got a really clean, sort of transparent way of tracking the funds and then tracking the use of the funds. So we can hand on heart, talk to the community and say, you bought something in Mildura, it's going to, Monash kids. So.
Yeah, right. Wow. I mean, we've done, some work. So you came and spoke to the foundation ourselves, and we were just blown away by the potential to change well-being and health for kids and to improve it, particularly in the Sydney hospital network. So children's
Tell us what you found, Adam, as well. So what is homesickness to you, and being our researcher?
So then I just got my little pointy academic hat on and I went, I'm just going to sort some of this stuff that Nicola's talking about and see what's actually there. And I was surprised, actually, because I was surprised by two things. The first thing I was surprised in was that there's actually not a lot of research around child health and wellbeing transdiagnostically in hospitals. It's basically, I mean, this may surprise everyone, but there's very little stuff. There's a lot of stuff in domains like cancer or diabetes or in a particular ward, but nothing that's about the general well-being of kids. And that surprised me because if it is in a specific domain or ward, the research tends to be about disease-specific or disorder-specific stuff that can't be taken broadly across the hospital. And so this idea of actually thinking about how we can support kids when they come into the hospital broadly, I think we found one paper, actually, that had been published on it in the last 100 years of scientific research that was at least somewhat focused on this topic. The second part of it that surprised me is you were right. So it didn't surprise me that much. But
the families know, Adam, the families know.
Your research that you'd done actually had set up the process and had come to the same conclusion that the number of studies around homesickness as well as around adjustment more broadly had found. And the first thing to say is that we know that homesickness, it impacts most kids. So we found that 90% of kids that go into hospital they'll report lots of fear and worry about being in the hospital, as well as feeling like they're missing home and the things that they miss about home. And when I say home, it's not about just their bedroom or just their game machine or their, the one thing in their home. It's about the whole lots of things. It could be about the sport, the teams they go to, the school they go to. This notion of home is really quite broad, but kids think about it, and they think about it all the time while they're in the hospital. And then the second thing we found is that kids have a lot of fears when they go into the hospital, a lot of uncertainty, a lot of thoughts about what's going to happen next, what's the danger, where's my security, and who are these people that keep coming to check on me, that sort of stuff. And that can become really quite distressing. So lots of rumination, lots of worry, and it tightly linked to anxiety and depression. And you think, well, like all these things, it would go down. And what the initial research has shown is actually it doesn't go down. Kids go in. The vast majority of kids in the hospital come in for a few days. They leave. But if they do stay for a long period of time, just the distress, the worry, the fear about not being home stays consistently across the entire stay. And so, that really surprised me. I thought, why, this is actually an important issue that hasn't been addressed. So what, we know that there's a cognitive aspect about thinking about and worrying about and intrusive thoughts and nightmares and all that sort of stuff. And then there's the sort of emotional aspect. And finally, there's a sort of behavioural aspect, whether it's withdrawal or we know that homesickness is actually associated with treatment compliance. So, there's lots of different factors that feed into this. So we thought actually maybe this is an important issue that we do need to address, as Nicola has suggested.
Well, it was the parents and the kids and the staff of the hospitals who knew, they just knew that this was happening. And it really lifts us to hear that there is, you're uncovering that it's a thing, it's a real thing, and that then we can work out what are we actually going to do about it, and reducing those number of days, because I think, that's an incredible point. Children don't get used to hospital. It doesn't go down. I presume it just finishes when they leave, or the morning they know they're leaving, or and we make the hospitals as home-like as possible. And I think the kids' hospitals, for any of us adults, they're so much better than adult hospitals. They're going out of the way for the cleaning fluid not to have the ammonia smell in it, and the color, and the clam doctors. I think we do the best, but I think we also know that you cure homesickness by getting kids home.
Yeah, absolutely. And, some of the work actually showed that the homesickness, not only was it associated with treatment compliance and the speed of recovery from whatever the reason they were in the hospital, but it was also associated with other mental health problems. So as I think I said earlier, the significance of it is around how does it influence things like anxiety? How does it influence depression? How does it influence the parents' worry? It's a huge worry, isn't it? You've just frozen. And we have Nicola coming back. Hi, Nicola. I've just been talking to myself, to the audience, trying to say something really interesting, but I'm not that interesting. You're far more interesting. So I'm sorry. You're going to have to kickstart the conversation again.
I'm so sorry. And I was talking away madly. I didn't realize that it all disappeared. So I'm so sorry about that. Adam, I think where we got to was more around what this research might tell us, and how there's some questions as well. How we might be able to reach all of the children. So there's at least 500,000 children in hospital every night in Australia. So the people were, it's a very, very large number. And that understanding more about what's driving the homesickness in kids, and especially you were referring to compliance here, and the sense of anxiety, etc., can sort of manifest itself around not wanting to participate in their own recovery. We know that, and parents tell us tell us that often. But what is your hope for the research, Adam? What is it that you, in this next sort of phase, that you hope to sort of engage in and uncover for us so that we can take the next steps in curing homesickness?
Yeah, well, actually, what we're aiming to do really is to address the needs of kids and families when they present to the hospital, and not, the hospital does a great job in providing various treatments and supports. I mean, some of the best in the country. I just want to say this, when there's complex cases, the place people go to is always the hospital. The hardest cases, the cases where no one knows what else to do, it's the hospital that will do a wonderful job in providing treatment and support. But what, as a role of necessity, those clinics tend to do is focus on the presenting problem that's associated with their specialist concern. So, of course, if it's a chronic health condition, it's all about that particular chronic health condition. If it's epilepsy, it's all about epilepsy. If it's a neurodevelopmental concern, it's all about whatever is recommended for that neurodevelopmental concern. But what we need to do is actually provide a really excellent assessment that addresses the needs of families and kids so that we can put supports in place and get them home faster through addressing the sort of transdiagnostic needs. I think that's the key here. And there's lots of things that this opens up. It isn't just about looking after mental health, although that's going to be a really big part of the homesickness initiative. Mm-hmm. It's also about changing practices in the hospital with the focus of getting kids home faster. And COVID's really accelerated that process. So there's the home in hospital, the hospital in the home, service is all about trying to get kids home faster. And I think there's a huge role for the Homesickness Initiative in trying to do that.
Yeah, and just looking at in chat, there's two points as well, and I'll come back to the first comment, which is what else does the foundation do to the hospitals? But homesickness implications for kids in quarantine settings, absolutely, and that will be another interesting piece sort of to take further. But also how the COVID restrictions have impacted the family, because of course we went from parents and siblings able to visit to then parents and then only one parent, protecting obviously all children and healthcare workers for doing that. But just my brain, and my heart would tell me that, well, then it would make homesickness even more because of the lack of connection to family, even in the hospital setting. Have you any thoughts on how COVID has sort of impacted the concept of homesickness and how we're experiencing it?
Yeah, I mean, it's made it a massive priority. We know that there are a lot of kids contracting COVID, and a lot of them are remaining in the community, but there is a portion of children whose parents contract COVID, and Phil Britton spoke to this in great detail about 2 months ago now. But kids coming in without family support, staying in the hospital, and having almost no family support around them for however long. Sometimes they're in there for weeks. So one of the studies we're actually doing is actually to track homesickness in kids in that population to understand what their needs are while they're in sort of quarantine. And we're actually starting that study up in the next couple of weeks. And we hope to be able to provide answers which give much better support to kids while they're missing home. So yeah, that's one of the strategies, and it's the only study I know of its kind. So really important outcomes.
Oh, that's wonderful. Because the hospitals were able to become safe havens for kids who also, weren't able to be looked after at home because their parents were sick. So the whole pandemic has given us quite a different view. If I was to take a positive view of that, it accelerated telehealth, which I think was really important. We were proud to be able to put more funds towards telehealth in the network so that children could get home sooner, or indeed be treated closer or at home. And I think there's some really interesting stuff in that telehealth stuff. Some of it's just the actual infrastructure that the hospitals and universities and everything might have. But when you go to rural and remote, the local GP or wherever doesn't actually have that. It doesn't matter how good the IT is at our end if it's not at the family or the GP end as well. But then just being able to communicate this way and get a message across and get the same sort of information back. We know that it's not, humans aren't two-dimensional beings. We need all that sort of body language as well. But I think the work done has been spectacular in that.
Yeah, I mean, even just to think even about practical strategies about mask wearing, we've got people developing masks now that are clear so that we can try and improve the interaction and communication between staff and kids.
Right.
You know, we've got new devices we're planning to use around to connect families to their kids in a more interactive way and more sort of engaging way. So yeah, there's a whole range of strategies we're looking at. If we answer, we've gotten to 40 minutes and I'm not sure if we've covered what we're supposed to cover, Nicola.
So what I hope we were covering was letting families know that with your support in the research, we've identified an element of homesickness in the hospital setting that will develop the research to show how we can solve or cure homesickness at the same time as treating the illness or injury and give the child a better overall well-being experience, but take actually a shorter experience in hospital and get them home to their families where they thrive. That is based in research. It was a germ of an idea, but actually we're starting to do some extraordinary research, which ultimately will just help our amazing clinicians give even better care to kids while in hospital. I use clinician in its broadest term, doctors, nurses, allied health professionals, everybody. That there's a way that all families and community can help this initiative, and that's Cole started off with one pasta sauce. There's now 3 pasta sauces and a pizza sauce, and Secret Squirrel, they're launching 3 more products in the new year.
Wow.
And they've never given as much as, you know, the profits to any other charity. So we're very pleased. They really
Are you allowed to say which sauces the people have got to buy? Is that allowed?
Okay, it's called Mum's Sauce. Sorry, I'm so used to it. And it's spelled S-A-U-S-E because one of the kids, that's how they wrote it when they were telling us what they missed. Now, some of the education groups were not happy with us doing that. I just have to acknowledge that, and I understand that, because that's not how you spell sauce. But it was directly from a child, so we use that. The family were very happy for us to do that. And so, yeah, in Coles, exclusively in Coles. So they really pushed the boat out. They produced that product, did everything, because they're trying to sort of connect with their community and know that their staff, think of all the people they employ, their staff's kids are in hospital, their customers' kids are in hospital. They know they can make a difference. So yeah, please go out and buy that, and you'll ultimately help Adam, and you'll help all the amazing clinicians in our hospitals all around the country. Our pediatrics,
actually, yeah, I mean,
pediatrics, only pediatrics. Yeah.
Pediatric hospitals. One of the things I did want to mention though is this is leading to one of the a really unique opportunity to do something at a national level with the different hospitals. So I think that is something that's most exciting, that we, as we said before, the foundations can become the vehicle to promote national-based research across different hospitals. Is that? Yeah.
Absolutely, it is. We all fund the same thing. So generically, we're interested in investing in research of all kinds. And the clinician research as well as the pure academic research, all very important. It solves issues for kids now. It gets diagnoses now when maybe there hasn't been any. And then it's about the future health for all kids always. Then clinical care. So this is about making the care that all of the health systems, I can only really speak for New South Wales, but they provide good clinical care for our children. They provide good hospitals. What we do is we go above and beyond to do the things that governments would never do. The couple of examples that we have, 2 major donors, if a little arm or a little head needs a cast, you know, the way that it's normally done through the health system is quite good. But one donor bought a piece of equipment, $800,000 this piece of equipment costs. And in my terms, and I've been told I can say it this way, it sort of scans the little arm or the little head, and it produces like a reverse 3D printer, a cast specifically for that child. It means it's more comfortable, it's more effective. Yeah, a government's not going to do that right now. And then the donor was so successful in Randwick, bought another one for Westmeath. So we're really proud of them. There's another piece of equipment that children going through various diseases, cerebral palsy, whatever, the constant CT scans, MRIs, you know, the radiation that sometimes our children experience through the treatments that we give them has a really negative lifelong impact. And so this is like a TARDIS, and you can walk into it, stand into it, or push a wheelchair into it, and it's 0.8 of a second, and over the life of the average child stay in hospital reduces radiation by 80%. And we can put these things in, invest in these and with donors' money into the hospitals, because then governments can catch up, because we've shown that they work, that we've reduced the risk, and we found a better way to do it. So they're the sorts of things we do. And of course, patient experience. So we know child life therapy, we know music, we know art, all of that gives the child the skills to have the best experience that they possibly can. And then siblings can participate, you know, we've, you know, clinician-free zones where kids can just go and be kids for a little while, because that is our philosophy as well. It's children first and patients second. So that's what we do. We try to bring the best and the brightest ideas from around the world to our hospitals here in New South Wales and support our clinicians. And another thing we're very proud of doing is government provides education, if you like, to become a generalist pediatrician, but not the specialist, to do the fellows or the PhDs, whatever. And we're very proud to fund that ongoing education so we can attract and retain the best and brightest minds, like yourself, Adam, in our hospitals here. And then you can share the amazing work you do here nationally and internationally. So that's why the foundation exists. Healthy kids, whatever it takes.
Thanks very much, Nicola. I think that's why I needed you to stay, because you just speak so fantastically well.
Gosh, the people I meet, Adam, the families, the kids, the clinicians, it's just inspiring. I mean, there is sadness in what we all do and what we're all here, but my gosh, it's inspiring. And so thank you. And thank you for this. And thank you everyone for listening.
Okay, thanks very much.
Bye.